be recording this meeting, and that will include the chat as well.
Hey, well, I think we'll go ahead on and begin tonight's session. So good evening, everyone, and thank you all for joining this information session. I am Dr. Monique Felder, Superintendent, and welcome to tonight's session. This information session is designed to share recent information about safety and health guidelines and expectations that will be employed in Orange County schools for starting the school year, and to also address any questions that families may have. Next slide, please. So without question, and as everyone knows by now, the Delta variant has changed a lot of our guidance and expectations in just a very short amount of time. Next slide, please. But our goal remains the same, and that is to mitigate the transmission of the virus in order to have a safe and healthy return to in-person instruction for our students and staff. And not just to open schools, and we actually have one school open now, Hillsborough Elementary School. It's been open for 5 weeks, but we want to ensure that we're able to keep our schools open. And here's why. Next slide. So our own data indicates that our children have suffered academically and social-emotionally during the pandemic by missing out on in-person learning, classroom time, and socializing with friends, as noted by the data on this slide. We want to do all that we can to open our remaining schools. As I mentioned, Hillsborough Elementary has been open for 5 weeks. But again, not only to open the remaining schools, but we want them to remain open. The first data set is a composite of third grade reading proficiency per the end of grade assessments. While clearly these data show that achievement was stagnant before COVID-19, so that's clear. We know that student achievement plummeted significantly as a result of COVID-19. We also know that third grade reading is important because, among other things, one of the most important predictors for graduating from high school is reading proficiently by the end of third grade. So we do have other data that is alarming with regards to the impact of COVID-19 on students' academic performance, but are sharing this data set because, again, students' achievement or being able to read proficiently by the end of third grade has long-lasting effects. And the second data, which is a pie chart, provides insight into our students' social emotional well-being. So not only did our students, were they impacted by COVID-19 with regards to academics, they were also impacted with regards to not having access to in-person learning, with regards to their social emotional learning. And so the pie chart shows that of the referrals made last school year, 55%, so more than half of those referrals were for suicide assessments. That too is alarming. So the district is taking a very cautious approach because of how much more contagious the Delta variant is. And we want and know or are aware of what's happening in other districts that are currently open. And so we want to avoid transmissions. We want to avoid major quarantines. We want to avoid remote instruction, as again, our data shows that that didn't serve the majority of our students well. We also want to avoid severe illness or any casualties. as a result of the Delta variant. So I cannot stress enough how critically important it is for all of us to be vigilant with regards to adhering to all of the safety and health guidelines and expectations that were not developed in a vacuum. As I shared the other evening, we are educators. We are not medical professionals, but we are fortunate to have strong partnerships with those who are in the field of medicine and healthcare and have um, very well versed in COVID-19. And so the guidelines that we have were developed based on the North Carolina Strong Schools Toolkit, as well as in close collaboration with the Orange County Health Department and the ABC Science Collaborative. So at this time, I'm going to turn things over to Mr. Patrick Obley, who is our Deputy Superintendent of Operations. But before I do, should you have questions or any wonderings throughout this presentation, there is a chat feature, and actually Ms. Stowe, Melanie Stowe, who is our Chief Communication Officer, could provide a little bit more guidance, but you do have the chat feature as a way to share any questions or wonderings that you have, and our goal is to do our best to address them in this session. If we are not able to do that, we will certainly follow up. So with that, I'm going to turn things over maybe first to Ms. Stowe, and then Ms. Stowe will turn things over to Mr. Arberly. Thank you.
Thank you. Good evening again. Thanks for everyone's your time this evening. We will be using the chat feature. If you have any questions, if you would please insert those, and we will do our very best to get all of those answered before the end of this session. And should we not be able to do that, we will be posting an FAQ and also sharing a recording for anyone that wasn't able to attend. So please insert any questions you have, and we will answer those at the conclusion of Mr. Abelay's presentation. Thank you.
Good evening. I'm Patrick Obley, Deputy Superintendent for Operations with the school district, and I appreciate you tuning in this evening as we present information on our processes and protocols and requirements to keep our environments healthy and safe, both for students, staff, visitors, and our community. I'm going to leave this slide up just for a minute because our focus is absolutely on the impacts, the educational impacts of students and protecting the learning environments for this upcoming school year. All of our staff and operations, no matter what role they play, is laser focused to ensure that we're doing our very best following requirements, recommendations, or best practices on how we can efficiently and effectively keep schools open and keep those schools safe. We know this pandemic has had real impacts for our families, for our community, for our schools. That includes both those of you watching this evening, but also our staff members as well, whether that's been job losses within the household, opportunities that were lost, and tragically, individuals who have lost family members as a result of the pandemic. So we know when schools are closed or individuals have to be out of schools, whether that's short-term isolation or quarantine or a school closure, that has real impacts to families and individuals being able to do what you do, which is provide the very best that you can for your family. And so we want to talk a few minutes about what safety protocols and what measures are currently in place. And many of the items are stemming from best practices that were implemented last year, but also as we move forward, the guidance and recommendation, as Dr. Felder said, from both the ABC Science Collaborative, from the Orange County Health Department, North Carolina Department of Health and Human Services, CDC, or any of our other resources that we utilize in putting together the best efforts in the plan as we move forward. Masking and universal masking, the Board of Education approved at the previous board meeting on August 9th for universal masking, both indoors and outdoors. As we look at community and transmission rates for COVID, all North Carolina counties as of yesterday, except for one, were indicated for high transmission rates. And so it's important we understand both what's happening around us, but what's happening also within our district in our county when it comes to transmission rates for COVID. We know primarily that the virus is transmitted through the air from one individual to another individual. Certainly there can be surface contact or surface exposure as well, and that's where sanitation, cleaning, hand washing are all best practices to help eliminate any surface contamination or cross-contamination or virus impacts. But wearing a mask and wearing it consistently, properly, and appropriately is absolutely critical as we move forward with having individuals inside school buildings, and that's both for staff and for students. We take that responsibility very seriously. Students that are riding on school buses, school bus drivers, they also will be required to wear masks and face coverings as well, because again, we know the primary mode for transmission of the virus is from an individual to another individual. Those universal masking requirements are for both vaccinated or unvaccinated individuals. We know that a certain age level of our students, especially those under age 12, I mean, they're not eligible for a vaccination. And so it's important to understand that half of our school population is not even eligible for a vaccination at this point in time. And so the next thing that we would put a focus and an emphasis on based on the toolkit from the State Department of Health and Human Services is on vaccinations, promoting vaccinations and getting information out to individuals about vaccinations and the effectiveness of vaccinations with helping limiting the spread of the virus within environments, and especially a close environment like a school environment. There's other mitigation and strategies that are continuing from last year with an increase in ventilation as we reviewed mechanical systems, making sure that our systems were running to full capacity, the use of air purifiers inside classrooms. This year we've put bipolar ionization, which is a unit that helps sanitizes the air in larger spaces where portable air purifiers just can't work efficiently, such as in band room and music rooms. And then also ensuring that we're incorporating other best practices, especially utilizing outdoor spaces or outdoor areas as well. And we're in the process of reviewing with both the fire marshal, the town of Hillsborough, and the Orange County zoning department, updates to regulations or standards that would allow us to place tents on campuses to be able to extend those outdoor learning programs for students. And so there is quite a bit of information that currently was out about how we're addressing the needs to keep our schools safe. And then I wanted to talk about a few new things this evening as well before we open it up to questions. So based on the information shared with the Board of Education this previous Monday night, the following items here that we'll cover quickly for you were approved by the Board of Education. These first items on the screen you're going to see deal with primarily staff members and the requirements for staff members to be tested, to provide proof of vaccination, or to be part of a surveillance weekly testing for COVID-19 program. All of those are protective measures to ensure that our staff members are COVID-free, or if they don't know they have COVID, if they're asymptomatic, that we're helping to identify that early on so that we can limit any exposure or risk for students, and that we can avoid having clusters, outbreaks, or shutdowns within the schools. The surveillance testing is just that, it's surveillance. It's not diagnostic. Individuals who may have signs or symptoms of COVID, those individuals would still go to community health partners, whether that's through the Orange County Health Department, pop-up COVID testing locations, Walgreens, or other community sites for diagnostic testing. Those would still be available for individuals. Again, our testing is for surveillance, helping us understand and analyze, do we have COVID cases from individuals who may not know or be aware that they do have COVID, which could contribute to the spreading of it within our environments. Number 4, once the COVID-19 vaccinations are listed as FDA approved and no longer under the emergency use authorization, the employees would be required to become vaccinated within 30 days. And certainly by law, if an employee has an approved accommodation, they can submit that because there may be some cases where individuals based on medical or other reasons cannot receive a vaccination, and so there would be the same process that we would utilize that follows the regulatory practice for vaccinations. And then we also wanted our families to understand and know that if our schools are closed for students, our employees will still be reporting. We know services can still be provided from remote locations, but we want to ensure that we're engaging the best possible ways with our students, with the learning environment and our technology. And so we are asking all employees and having them report to their assigned work location if a school is closed. Now, there may be individual cases, whether an individual is in isolation or quarantine, and they may have an ability to work remotely, or they would be on appropriate leave at that point in time. The Board of Education approved biweekly testing for all students, coaches, and individuals involved in athletics, cheerleading, club sports, chorus, marching band, or other extracurricular activities outside the school day that's not graded. These are activities that students would be involved with that are not required as part of a class requirement. Those individuals, again, especially with athletics or when they're gathering with large groups outside of the school day, they are higher risk for transmission of COVID. And we do know with the Delta variant, the transmissibility of that is much greater than it was with the strain, the original strain of COVID SARS-2 that we were dealing with last year, or one of the other variants that's out in the environment. And so it's important that we take additional measures starting with these groups because they are indicated to be high risk groups. But again, if it's part of a class or a class requirement, this provision would not apply to them. And so this biweekly testing for individuals who are not vaccinated, again, allows for screening and allows to ensure that the individuals are able to participate and that we're able to reduce the possibility of transmission outside of the classroom, but those individuals we know will be inside the classroom as well. And again, that provision is for both the students and the coaches and others involved. And so also as new employees or employees coming into the district, it's already a requirement that a health certificate by North Carolina law be completed by individuals upon initial employment. And so those individuals would be required to be free of communicable diseases, including TB, COVID, et cetera. And so we would be performing surveillance testing on staff members. Staff members would be tested prior to employment. And then we would start as well having weekly tests for individual staff members that are not vaccinated. And then this requirement here is for those that participate in athletics or extracurricular activities outside the school day, because there are no requirements that require them to participate. It is a voluntary participation. All field trips, we would limit field trips at this point in time based on the community transmission rates of COVID to in-state only. We would allow destinations outside of Orange County. However, that would be based on health, community, and transmission rates for COVID-19. And then additional travel restrictions may be imposed by the superintendent. And we know, for our families, we do our very best to protect the environment on our school campuses and that we have. And so we also had to be mindful that not all places students may travel may have those same protocol or standards. And so we do reserve the ability to cancel or not allow travel to certain locations or other restrictions. And then for our staff members, already we're not allowing staff members to travel outside the state. That's been suspended. And then as conditions evolve, we'll continue to monitor and limit staff travel within the state as well under the same guidelines that I just mentioned for students with community and transmission rates. And then the board authorized the superintendent to consult with the provided state contractor. Again, we haven't been able to provide surveillance testing or these other testing programs to this point in time for a couple reasons. That one, was availability, and two, was the funding for that. And so we have received, as many school districts across the state, funding through the state to provide for the surveillance testing. And so one other program would be to work with our state contractor and allow other testing for students on all campuses, K-12, with parental permission. Anytime we're testing students, it requires parental permission, but this would allow us to do surveillance testing for all students, and that could be on a weekly basis. It could be on a quarterly basis. Again, we've not finalized a plan for that, but this just did authorize the superintendent to start working with the state contractor on what possible plans are, and the contractor that's utilized has been doing this process for school districts across the nation, and they do have experiences with best practices on types of testing that schools may undertake. And so that plan is still being developed and still being identified as to what that might look like as we move forward. And so those are some of the just top items of information that was a result of our board meeting this past week with the Board of Education. And so we wanted to just spend a few minutes this evening giving you those latest updates. They're also in the board update that was submitted or sent out to individuals as well. We do want you to know there is a back to school health and safety updates page on our website. If you click the link within this presentation that'll be posted, or if you go on to the Orange County Schools website, right on the main page on the left-hand side, there's a link for back to school health and safety updates. It'll take you to a page that has the latest information, and part of the information on this site is an information guide or brochure. There may be items or topics that are not listed on here. We try to pick out the most critical, essential that we're asked about or that we receive questions in reference to for families to have those posted. We also will have updated frequently asked questions or other information. This is available in English and Spanish. You can download this guide. I've just got a sample of some of the pages showing on the screen here. And so we would invite you to seek out additional information by utilizing this guide. And you can see on the first page of the guide, this is as of August 18th. So this is as of today. However, I will tell you, we're receiving information constantly. The North Carolina Strong Schools Toolkit has already been updated this evening between the 4 o'clock session that we did for staff members and the 6 p.m. session this evening. I just pulled it up and there was an update that as of this afternoon. So, as information changes, we wanted it to be in one place or one location for families to be able to find. And we've done the same thing for our staff members as well by condensing the resources and information so that we can be consistent, we can be clear, and we can communicate the requirements and expectations, because we will be holding folks accountable from individuals in our office, whether it's in the operations department, our transportation department, our central services, any of our departments at the district level to all of our schools. We all have to be on the same page of how we're protecting our students and our school environments. And so we want to be very clear about those expectations. So that's just a snapshot of information we wanted to share with you this evening, and I'll turn it back over to Ms. Stowe, and she'll guide us through questions that I'm sure are probably already coming into the chat for us.
Thank you. So several questions. Just want to answer one common theme that some folks have, and that's with regards to close contact. And there is a link shared to the definition by the North Carolina Department of Health and Human Services and the CDC in the family back to school guide that's on our website, and it's predominantly located on the front page, and you can click back to school 2021, 2022. But I just want to remind everyone on the call that close contact was a bit easier to define in the spring when people weren't vaccinated and we weren't all back in school. And so close contact is 6 feet. So if you're within 6 feet of an individual who tests positive for a total of 15 minutes during a 24-hour period, that's a close contact. However, the North Carolina Department of Human Health Services has updated that guidance, and when students are in the classroom, a close contact is now within 3 feet. And so the question from several folks on the call or in the session is, do you have to quarantine and how long? Your child's school nurse, in collaboration with the health department, will provide that data to you, that information to you, and that will be based on a number of factors. There is not a clear definition of your quarantine is 10 days, 12 days. It depends on a lot of different things. So I just want to just remind you that should your child or you be identified as a close contact, that is on a case-by-case basis. And then another question
If
that
I can just jump in and
yeah,
just
sure.
add to that. So that was part of the toolkit update today. And what you said was exactly correct. That 3-foot standard is still in place with the Orange County Health Department. There was an update to that within the toolkit today. However, we're still locally with the Orange County Health Department using 3 feet. And I will say to all of our families, you know, we have stressed and explained to school leaders and administrators the importance of what it means when individuals have to quarantine and would be out of school and the impact to families. And so, you know, there are best practices being put in place to minimize. So if an individual is positive, to minimize the amount and the number of students who may have been a close contact.
Thank you. And there were two other questions specific to close contacts and transmission. And we do have a public facing dashboard. It's on our website, so you can see if there are any positive cases by any location. In addition to that, if your child attends a school and someone tests positive for COVID, you will receive a communication. And part of that communication in bold will state if there were close contacts. And if there were, they would have already been notified. You don't have to wonder or wait. You would have already been notified. And one of the questions was, have we had any secondary transmission? And to date, no, we have not. We opened our schools back in the fall for our EC separate setting kids and preschool students, in addition to some supervised learning labs. And we have not had any evidence of one student being or an adult being positive and sharing that with a student at school. So the things that we are doing are working, and we want to continue that data point. There is a question, Mr. Avale, about when do families need to show the proof of vaccination for their student athlete or their student who's participating in an event or a program that's going to require that?
Thank you. So the athletic trainers and athletic directors at the schools are already collecting and gathering that information, and school nurses have also been working to assist them with that process. We started that already, and so you may be asked directly to provide that. We're not keeping information. We'll ask the student to either show the letter from the medical provider or the vaccination record. They'll review it, make a note that it was reviewed, and then give that information back to the athlete or the parent to keep but we are not keeping that information on file. But it does require, it's more than someone just telling me I've been vaccinated. We do have to see the proof.
And there's a question with regards to recent reports that vaccinated individuals are now testing positive in some instances for COVID. Why are we only testing the unvaccinated for extracurricular activities and athletics?
Yeah, so a couple reasons. One, certainly that is true, but the rates and the amount of individuals that are testing positive is greatly reduced. Our lead school nurse can't be with us this evening, but one of the items she shared after talking with the health department today is 95% of the hospitalizations right now are individuals who are unvaccinated. And so we know the rates of transmission and the rates of spread are much greater among individuals that are unvaccinated. However, as was mentioned, you certainly can have individuals who are vaccinated that could be asymptomatic, which is why our surveillance screening for all staff includes everyone. As far as the students, the second thing is availability of the number of tests, and we are doing the PCR test. We are not doing a rapid test, so our tests take about 24 hours by the time the test is taken to get the results back from the lab, and that's all kept confidential. And then individuals from the health department or the school nurse will follow up with families if there is a positive test. So when we look at availability of the test, then we're certainly concentrating on those individuals that are unvaccinated. However, if the guidance changes or if information comes to us, then certainly we would have the ability to make a switch. But the guidance documents, the toolkit guidance documents talk about risk and transmissibility among with the athletes, the unvaccinated individuals, and the recommendation that they test twice a week. So that is how we're starting the process.
And is there a timeline for when individuals, students, or staff need to present that data or that proof?
Yeah, so they're collecting the information right now, so we have that. We're about 2 weeks away with our vendor from being able to start hosting the vaccination clinics on site, and so we're collecting that information currently on the athletes at the school level. And we should have all of those athletes that are currently on teams reporting. Right now, we're concentrating on those teams that are scheduled and are participating at this time. If it's an out-of-season sports team, right now, we're not in baseball season, for instance. We're not collecting that information because it's not time for that season yet, but we will be at a different point in time. Right now, we're focused and concentrating on those teams that are currently in season competing. And so as far as a timeline, I mean, we would look to have that completed before the Labor Day holiday.
And there's a question with regards to if we did need to return to remote learning, is there any type of, what type of notice would we plan or like to give families?
So I'll turn that over if we have any. I've got several, we certainly have several colleagues on the call this evening. I'm not sure if we have someone from the academic services team that wants to talk about remote learning and notifications and the plan briefly on that.
Thank you, Dr. Abley. Mr. Abley, I was trying to unmute. Sorry, can you see and hear me okay? Can you hear me okay?
Yes, you're live.
Okay, great, thank you. So should we have to pivot to a remote learning situation? First and foremost, say that an individual student has to, of course, then we will work with the family and ensure that they have access to instruction in a timely fashion. Should a classroom have to go remote, we would have a plan. We've convened with teachers to get input, and we are working with our facilitators and coaches to make sure that we have plans that will support our teachers and our students should we have to make that pivot. I know that when all of this initially started, we had no notice. And so hopefully this time around, should we have to pivot, that we will have notice that will allow, for teachers to have their laptops, of course, and some, guidance. But we'll be ready. We will continue to, keep our blended learning and teaching going on, meaning that we will continue to incorporate our online platform for accessing assignments and different types of lessons. We will keep that blended model of instruction going, regardless if we're in person or not, and which will make it a little bit easier should we have to pivot to remote learning. And this is a plan that we're working on with our teachers because, of course, we had an opportunity to have some lessons learned from last year. And so we're reviewing those lessons and then seeing what were some of the best practices that we can keep should we have to pivot. So that's our aim. We're hoping that we do not have to, but should we have to, we will be prepared to make those shifts. Thank you. I hope that answers the question.
Thank you, Dr. Dawson. And I will just reiterate what's been stated a few times is that our goal, because several parents have shared, they don't want their child quarantined. They want to be in person. And that is why our goal, number one, is safety, the mask compliance, and just all the safety guidelines that we have in place because we don't want anyone to have to quarantine who does not have COVID. That's our goal. So please be assured that we understand we want students in person as well. There's also a question specific to mask compliance. And is there a way to report that? And I'm going to put that in the chat and let Mr. Abele just maybe piggyback off this. But we do have an anonymous phone number that receives voicemail messages 24/7. We have an anonymous email. Should you not feel comfortable sharing that directly with your child's teacher or principal, any non-compliance will not be tolerated. And I'll put that in the chat.
Yes, and I would add to that, we also have a compliance program, especially with masking, that's observed by individuals from the district office as well. And so we'll be out in schools once school begins on Monday, monitoring and ensuring that compliance checks are done and following up with principals or areas where we might have concerns regarding compliance, because it's important from day one, the moment students start on the buses to when they get off the buses and they enter into school buildings, that we're following protocol, we're following procedures at the very, very beginning. And so we will have mass compliance checks and other checks on the environments as well. And even as we've been meeting with staff, individuals this week, we've been following the same protocols, and many staff members today were joining in the superintendent's convocation and district convocation message from their individual classroom, because just not having and wanting to bring folks together so that we can do everything we can to protect our environments and getting ready for students to come back.
There's also a clarification question with regards to has it been stated that we would test all students if the state approves it?
So the state testing program, we're working with the provider on the capacity. We have the ability under the state under the state program. We just have to make sure our provider has the capacity and what that looks like so we can work out the logistics. Any testing that's done requires parental permission. So we would still need to work through the parameters of notifying parents, giving them the opportunities for students during the school day. Now, as was mentioned earlier, for athletics and for those extracurricular not tied to the school day, it's already a requirement from the board that they day test in order to participate, but still parents have to give permission. But as far as the regular school day, we would be working to get that communication out. And that's why our board has asked us, asked the superintendent and our team to bring back a plan as to what that might look like.
Thank you. And there is a question from an individual specific to how to notify your school if your child has COVID or someone in the family and you're not sure what to do. And this individual referenced a reporting form. We did last December over the winter break use a reporting form because we knew that some people were going to be on vacation or not maybe accessible at that moment. We do not use that reporting form. So in the event you have that link, we're not using it. We are asking that if you have any questions about whether your child should come to school, that you contact your school nurse immediately. And we do have a link to that. I'll put that in the chat as well. We have all of their names and numbers listed on the website, and I'll put that in the chat. Mr. Obley, there a few questions continue about the differences between vaccinated and unvaccinated, and how are we addressing that with staff with vaccinations, particularly with the elementary school students who aren't able to be vaccinated because it doesn't exist?
Yeah, so again, we're about 2 weeks away from our vendor of rolling out the testing. However, we are securing some testing capacity with the Orange County Health Department. Next week, we'll do some drive-through clinics for bus drivers, our substitute teachers, and start the process before our state vendor is set up and ready to go. So one is finding local capacity if we can to start the testing process. Two, as we roll out, certainly we'll be targeting those schools where students are not eligible to vaccinate as the first wave of individuals that we want to. And then we're already in the process of working through the technology for capturing and reporting staff members' vaccination status. And so we'll know by cohorts or by schools, what our vaccination rates are. And then we'll start, continuing the weekly COVID testing at that point in time. While we're waiting to get those programs in place, that's why masking, physical distancing, and following all the other protocol are still critical and essential. And regardless of the vaccination status, there's just essentials that are going to be required of staff members. And so we'll continue to monitor and implement those. But certainly understand the concerns from a parent's perspective, and even for me, as an individual from the district office, I've visited several schools this week, and I can tell you all of my visits were 15 minutes or less. We also try to limit like the number of schools. Typically when I was here in the district previously, I could visit all 7 schools in one day. I wouldn't attempt to do that right now because, again, I've got to think about the places I've been and who I could have been exposed with or where I could have been exposed. And so we limit our travel and we limit the number of buildings that we're visiting or we're in, and really save trips for essential or critical items or, reasons we have to be there in order to limit exposure and limit individuals across campuses.
And I'd like to pose this question to Dr. Dawson with regards to remote learning and if that's an option. We do have an online academy, but I do want to make sure everyone's aware. Last year we had Plan A, Plan B, Plan C. There are no plans. We are required by the state to be fully open. So I'll turn that over to Dr. Dawson with regards to, we do have an online academy.
Yes. So yes, you're absolutely right, Ms. Stowe. We are required to be in person. So it is not an option for us right now for students to stay in remote learning. We did create a new online academy for families who wanted to stay 100% virtual. And the application window has closed. We are at capacity, but families who are interested in attending and transferring out of their attendance zone school to apply to attend the online academy are welcome to do so, but being very clear that because enrollment at this time is full, that you'd be added on the wait list. And to be added to the wait list, what you'll want to do is, just like anytime that you're going to register for school online, our website, you can go and apply for online academy. And then the only thing that you want to make sure that you're selecting online academy, not your current school, and that will place you on the wait list. That is the one option for an virtual learning, and the only option for virtual learning at this time. The only time a student would be able to be remote learning is if, because of a quarantine requirement, that would be the only option and reason why they would be in remote. So there is no other option at this time. And the online academy is a K through 12 program. And so if a student also tests positive for COVID, that would be another reason why they would switch to remote learning, and only for the time that they need to be out. Soon as they're healthy, soon as the quarantine time is over, they would be returning back to in-person instruction. Because again, that is the way we are to return back to school, in person, unless you are attending the online academy as a full-time student to the online academy, not as a remote option, but that would be your new school. And again, we're capped for enrollment, but you can go and be added to the wait list.
Thank you, Dr. Dawson. And Mr. Avale, there's a question specific to if an individual, student or staff, is vaccinated, do they automatically have to quarantine if they've been in close contact with someone who's positive?
I think, okay, sorry about that. I was trying to get reactivated. So there are different requirements between the students within the classroom with that 3 feet requirement. It is a 6-foot requirement for staff members for the quarantine radius. And what they first would do if they're in contact with someone who's known to be positive, we would start the isolation process, not necessarily quarantine, but they would be on isolation until they have a COVID test, if they were in direct contact with someone within that 6 feet, 15 minutes, etc. The health department reviews each and every case, and even if they're not showing signs or symptoms, they would start the isolation process before the quarantine process would begin.
Thank you. I'm just reading through the chat quickly. I know that we're still working on the process with regards to extracurricular activities and athletics, but there have been a few questions about what that process may look like as to where it's not aligned for the vaccinated and aligned for the unvaccinated, that makes it very distinguishable as to who is or isn't.
As far as the testing piece, yes, that's correct. And part of how we'll set up the testing process for those students who are required to do the weekly testing, we'll certainly talk with our vendor and work with our schools, because one of the items that I mentioned when the board was discussing this was making sure, when we were on August 9th, when we were talking about testing, COVID testing for athletes, was making sure that testing is occurring before school, after school, or during lunch, so we're protecting the instructional time. But we certainly will work with the vendor on how and what that looks like, so that students can have some privacy with the testing process. Because again, all the students will be would be on the team, whether they're vaccinated or they've given permission to test. So, we don't envision, being out on the field where other students would be able to watch or monitor certain students being tested. That's not in the plans of how we would respect students in doing that. So just wanted to, hopefully that helps ease folks on the process.
Thank you. And I did just want to make a point of clarification, because we do have the Orange County School Online Academy, which is our 14th school, and that is what Dr. Dawson referred to, that currently has a wait list. That is not the same as remote learning. Should your child have COVID, or should your child need to isolate, there would be a remote option provided. It would not be that they go to the online academy for 2 days or 10 days. Just want to make sure I've clarified that. And Mr. Abley, okay, thank you.
No,
Mr. Abley,
thank you. And Ms. So is there a question in there about, I believe there's a question in there about the learning one. If you could read that one, that just came in right after the remote learning.
okay, I will get to that after I read this one.
Sure,
So
sure.
lose my place. That's okay. Mr. Abley, there's a question specific to why are we testing students and or staff who are involved with extracurriculars that don't have symptoms? And could you clarify who's going to be tested in extracurriculars?
Yeah, so the extracurriculars, what was passed by the board, where we landed with that was any individuals that are unvaccinated would be tested. However, as an employee, the coaches would already, or individuals would already be tested under the requirement that all employees be tested. So, they'll still have an initial test, and then would only, just like students in extracurriculars, would only be tested if they're in an unvaccinated status. Because we had two different discussions that landed with an approval at the same night, and so just needed to align those based on both requirements being in place. So either way, coaches will receive an initial, and then would only be required ongoing if they're unvaccinated.
Dr. Dawson, a question from one individual. With the learning loss from last year that everyone experienced, how is this being handled to catch our kids up for those who progressed on or ahead of where they should be?
Mm-hmm. Yes, thank you for that, Ms. Stowe. We do acknowledge that there was some unfinished teaching and learning last year. And we also know that for majority of our students, in-person instruction is the most impactful. And so that's why we're looking forward also to safely having all students come back in person. And the teachers are being supported to be able to diagnose, with formative assessments as students return, to assess what is it that our students did learn, what are the skills that they did not learn. But one of our key focus areas is that all teachers for all students will be starting with grade level content, because what research has shown us, even research, through last year, what research is showing us is that remediation is not the way to catch our children up from what they've missed, but rather accelerated learning. And what we mean by that is starting students with grade level instruction. And the first thing that our teachers will do as students come is to do some formative assessments, just like I said, to see where they're at. Some students may be advanced in certain skills, but then not so much in another. And some, and it's very individualized. So we want to know where is each student in their skill development. Based upon that, then teachers will have resources, and the district team, our coaches and our facilitators will be working to support our teachers to have the tools they need to provide what we're calling just-in-time scaffolding or supports that your children will need in the moment to be able to access that grade level content. And so, that's a big strategy for us. Also, we're taking a look at high impact tutoring, very customized for where each individual student is at. And it's through our tiered support that we will be able to customize where our students are to make sure that they're catching up on skills that they haven't learned yet. And then also for those kids who did advance, are they getting the enrichment that they need to continue to progress in their development? So we're trying to cover all of the needs of our students very purposefully and intentionally to catch students up in the unfinished learning, and then to for those of us who need to advance even faster, to catch up to where they need to be. So that's the focus of our staff, our teachers and our teacher assistants, our coaches and our facilitators, and we're very eager to get that work started in person with our students.
Mr. Abilene, there's a question with regards to once we begin to collect vaccination data, would that be shared by school? For example, 60% of students at this high school are vaccinated.
So that's a great question. We've not talked about the analytics of the reporting mechanisms. I will say what I have seen from schools that have implemented so far to date. Again, the student testing piece is just right now at the beginning stages across this state. But reporting of vaccination status and rates for adults, and then we would certainly look at what reporting mechanisms we could put in place for student groups. The way that would work is you would want to report it by group. Like athletics as a group and certain groups, but try to do that in a way where information, if it is shared by analytics, doesn't identify individuals or individual cases. So we would need to talk about that, about the reporting mechanism and what and how we would share on the dashboard. But that's a great question, and thank you for that.
There's an additional question with regards to athletics in particular. And for example, if one individual tests positive, does the whole team quarantine? Is it obvious that who has COVID, who doesn't?
Yeah, so unfortunately, whether we're talking about the classroom or out of the classroom, once an individual is no longer there, I mean, we certainly don't share the reasons for that. It is a case-by-case basis. The health department and the individuals who are doing contact tracing, they look back, I believe, and I may be incorrect, it's about a 48-hour period. They have to go through the scenarios and look at the timing and look at the impacts for duration with individuals. So I can't really answer the question whether it would be the whole team. My experience last year is because of the interaction of teams, either on the field, on the sidelines, or on the bus. It did seem like in the district I worked in that there were teams that were impacted. Now, sometimes in practices, we had kids in pods, and so therefore it was only a pod that was isolated or quarantined. So that one's a little more difficult to discuss as far as if the whole team would be quarantined. I will say before we run out of time, we certainly feel we are available to do additional webinars or additional series, and like tonight where we have recurring themes on several topics that we may need to dive deeper into, then we can do an upcoming session that just focuses on maybe that topic, such as athletics, since that's been mentioned several times.
Thank you. And that was the case last year with Orange County Schools and Athletics. Our athletic trainers and school nurses did a phenomenal job watching hours of footage to not just quarantine a team, but to quarantine individuals that should be because they were close contacts. We worked very hard to keep, and we understand the importance of that opportunity for students. So we didn't just take that lightly in the event a team was quarantined, and that happened very rarely last year. So real quick, I know it's 7:01. I want to do a real quick summary of the questions I see. We will be posting this online if we didn't specifically answer your question, although we've gotten most of them. There is a question with regards to if an individual in the family has symptoms, do I need to notify the school? So it's not the child that's going to first grade, it's the first grader's younger brother or sister. Do they need to notify the school nurse?
So our lead nurse is not available beyond tonight. I'm going to defer that and let's get that information back out, because with the changing guidance today, and I know they were in conversation with the health department specifically on quarantining procedures. I want to defer that, make sure we're given the latest information on that. And I believe they are addressing that of what happens if a member in the household, what impacts that may have on individual students or individuals that live in the same household. So I know that we can get that addressed.
Okay, thank you. And I do know one update in the toolkit that is new from last year is that last year, if you have multiple children in our schools, if one of your children tests positive, you were asked to pick up all the other children, all the siblings. That is not the case this year per our NC Department of Health and Human Services. So that is something new. And then I've copied all the questions. We will be sharing this video link for you to rewatch or for anyone that wasn't able to participate. We will also post an FAQ before the end of this week with all the questions summarized, the themes. And I see 2 questions we didn't get to. I promise we'll have those answered. And someone did ask about, do we have vacancies and is it because of COVID? We have the vacancies that we almost always have, which are special education teachers and math teachers. We don't have HR on the call. But if you know of anyone, we'd love for you to refer them to us. That we even have a bonus. But to my knowledge, and the last time I asked HR, which was last week, the vacancies that we're experiencing are no different than any previous year. They're just hard to fill areas, in addition to nursing. So appreciate your time. Mr. Abley, do you have anything to say before we close out?
Just know our goal is exactly what you expect of us. Having schools open for learning, for opportunities, for students in school, out of school, and to do our very best to ensure that we're following all requirements, recommendations, or guidelines to keep the buildings open and keep your child safe and healthy, and to have a very, very positive school year. So we appreciate your support and for engaging with us in the conversations.
Okay, thank you for your time. Thank you, Dr. Dawson. Thank you to Dr. Felder. And as Mr. Abley said, we will be scheduling future conversations, info sessions like this. So please share your topics or things that you'd like to hear more about, and we will make sure that we keep you informed. Thank you for your time.